Your mouth is so much more than just a smile. It's actually a window, and sometimes it can be a huge warning sign for the health of your entire body. So today, we're going to dive into that surprising connection between your gums and your overall well-being. And it all kicks off with a really simple question.
Think about it. You've been there, right? Sitting in the dentist chair, filling out that health form, and it's asking you about your heart, your stress levels, maybe even your family history of diabetes. And you're probably thinking, what does this have to do with my teeth? Well, it turns out those questions are the absolute key to unlocking a powerful and kind of hidden connection in your body.
To really understand this connection, we've got to start with the basics. What is actually holding your teeth in place? I want you to think of each tooth like a skyscraper. For it to stand strong, it needs a deep, really complex foundation to handle all the daily forces. And trust me, it's way more sophisticated than just a root stuck in some bone.
And that crucial foundation, well, it has a name. The periodontium. It's this whole group of specialized tissues that all work together in perfect harmony. It is truly the unsung hero of your mouth.
So forget what you might think about a simple root and a socket connection. The real magic is this incredible web called the periodontal ligament, or PDL for short. It isn't rigid at all. It's actually a dynamic network of fibers that works like a high-tech suspension system, giving every single tooth both amazing strength and just the right amount of flexibility.
I mean, this system is a multitasking marvel. It doesn't just anchor the tooth. No, it also acts like a shock absorber when you chew. It safely transfers all those bite forces to a jawbone. It delivers vital nutrients to keep everything healthy. And it even sends sensory information, like pressure, up to your brain. It's a living, breathing, responsive part of you. But what happens when that incredible foundation comes under attack? This, my friends, is where gum disease enters the picture. It's a problem that starts out really silent but can lead to some pretty devastating consequences. Let's take a look at how that damage actually happens.
Okay, so on the left, you've got gingivitis. Think of it like a tiny crack in a building's plaster. It's just an early warning sign. It's inflammation, and the best part is, it's completely reversible. But on the right, that's periodontitis. This is when the damage becomes structural. The foundation of the skyscraper itself is crumbling, and that destruction, that's permanent.
And this is what that first warning sign looks like. The redness, the swelling, maybe a little bleeding when you brush, that is your body's alarm system screaming for attention. And this is the critical moment, the stage where you can step in and reverse the damage completely.
But if that warning is ignored, the disease can progress to this, advanced periodontitis. You can see here the supporting bone has literally been destroyed, the gums have pulled way back, and the teeth themselves have lost their anchor. The foundation is literally dissolving away.
So what causes all this destruction? I mean, it's easy to just say, oh, you're not brushing enough, but the real story, as we're about to find out, is so much more complex than that.
Now check this chart out, because this is fascinating. While dental plaque is always a part of the equation with gum disease, for the vast majority of people, plaque alone isn't enough to cause major damage. See how in every single one of these scenarios, plaque needs a partner in crime, like a genetic predisposition or some other risk factor, for the disease to really take hold and do its damage.
And what are those other factors? Well, the things we see every day. Smoking, for sure, poor nutrition, uncontrolled diabetes, even high levels of psychological stress. All of these things can literally change the environment inside your mouth, basically supercharging the bad bacteria and making you way more vulnerable to that foundation damage.
And this is where we zoom out and finally see the big picture. All of those risk factors point to one single crucial idea. The health of your mouth is deeply, deeply intertwined with the health of your entire body.
And just like that, we're back to that form in the dentist's office. Suddenly, those questions about your overall health and your family history, they make a whole lot more sense now, don't they? Your dental team isn't just being nosy, they're looking for critical clues about your systemic health.
If you need a really powerful example, just look at this image. This level of destruction isn't from someone who just skipped brushing a few times. No way. This is the direct result of a rare genetic disorder called Papillon-Lefèvre syndrome. It is a stark, undeniable link between our genes and our oral health.
And the connections, they don't stop there. Think about bone health. Conditions like osteoporosis, they weaken bones all throughout your body. And, yep, that includes your jaw. And when you lose bone density in the jaw, it can dramatically speed up gum disease and seriously increase the risk of losing teeth.
And the list just keeps going. Stress can weaken your immune response, making it harder to fight off infection. Not getting enough of certain vitamins can weaken your gum tissues. Even things like blood disorders and really common medications can have a direct impact on what's happening inside your mouth. See? It's all connected.
So, okay, after seeing all these connections, we get to the most important question of all. Why does any of this matter? What is the big takeaway for your own health?
Here it is, the crucial point. Your mouth is not an island. It is a mirror, and it's reflecting your overall health. It can be a diagnostic tool that reveals the very first signs of nutritional problems, immune system issues, or even serious systemic diseases.
So let's just put it all together, right? The bottom line is this. Gum disease isn't just a mouth problem, it is a whole body problem. It shares risk factors with major conditions like heart disease and diabetes. This means your dental team is an absolutely essential part of your total healthcare team. And maybe most importantly, paying attention to your oral health is paying attention to your total health.
So we'll leave you with one final thought. The next time you look in the mirror, don't just check to see if you have anything stuck in your teeth. Look closer. Really see that window into your well-being. And just ask yourself, is my mouth trying to tell me something? Thanks for joining us.